In today's video, we'll be talking about the most basic and affordable ways you can use to take care of your oral health to ensure that you have that long-lasting, healthy, and beautiful smile. And we'll also be discussing some basic ways like brushing and flossing, and I'll be emphasizing on the best ways to go about them to ensure that you achieve the optimal results. I would also be talking about some oral habits that a lot of people engage in that puts their teeth in danger to dental caries, toothache, and eventual tooth loss. So if that's something you like to watch, make sure you keep watching this video to the end. Like, share, and subscribe to my channel if you haven't. And let's get straight to the video. Guys, welcome back to Dolakwa's Diaries. My name is Dolakwa and I'm your host for this channel. I'm a 500 level dental student living in Nigeria, and I create content about dentistry, lifestyle, and skincare. So today's video is another dental video, and I'll be talking about the most basic and affordable ways you can use to take care of your oral health. I'm sure you like your smile, and I'm sure you want to preserve your smile till you're old, and you can achieve it just by paying extra attention to the basic ways you normally use to take care of your teeth daily. So we're going to discuss the things that we've already been doing, but I'm just going to be emphasizing the ways you've been doing them wrong so that you can correct and change these ways to ensure that you maximize these habits and get the best results. Dental caries, also known as a hole in the tooth, is one of the most preventable dental diseases ever. Yet, we see a whole lot of people coming down to the clinics with a hole in their tooth that has caused them pain and they just want it extracted. Dental caries can be caused by a lot of things, and some people are unfortunately genetically predisposed to having dental caries, while for a lot of other people, it is an accumulation of the bad oral habits that they have engaged in over the years that caught up with them, making them have holes in their teeth. So the first affordable and basic way I'm going to be talking about is brushing. If you are watching this video, I'm sure you are old enough to understand what brushing is, but a lot of people don't know how to do it properly, don't know what to use, and they don't know how to go about it the right way. And that is why they come down to the clinic with dental caries even though they brush their teeth daily. So the first thing you need to understand about brushing is what to use to brush. So you're supposed to brush using a medium textured toothbrush and a fluoridated toothpaste. Let me break it down. So for the purpose of this video, I'm going to be using some props so that you guys will have a better understanding of what I'm talking about. The bristles on your brush, these are the bristles on your brush. They come in different textures. There's the soft, there's the medium, and there's the hard. First things first, you have no business using a hard textured toothbrush. Please and please. Continuous use of a hard textured toothbrush. I think a popular example is the smoker's brush that comes in that hard pack. Daily use of that toothbrush is going to recede your gums, and then you're going to realize that in the next 5-10 years your gums are receded and you can almost see the roots of your teeth, and that is one of the leading causes of tooth loss. So you have no business using a hard toothbrush. There's this myth that the harder the toothbrush you use, the cleaner your teeth are. That is very wrong. You don't need a hard textured toothbrush. Just a medium textured toothbrush is fine. However, for children can afford to use a soft textured toothbrush because their teeth are still developing and they don't have the permanent teeth yet. Dentists recommend that you change your toothbrush once in every 3 months, and that is for a very good reason. Once your toothbrush bristles starts to give way and scatter like this, then it's time to change it. But you don't have to wait till it scatters like this. Every 3 months, kindly get a new toothbrush. And when you are shopping for your brushes, look out for this sign that says medium right here. That gives you the information you need to know that you are shopping from the right toothbrush if you are an adult. Now, secondly, you ought to use a fluoridated toothpaste. A lot of people use toothpaste that are not fluoridated, and this is very bad because the fluoride in the toothpaste is at a concentration that is supposed to help your teeth get stronger. There's a chemical reaction that happens when we brush a fluoridated toothpaste. Fluoride from the toothpaste gets absorbed into the structure of your teeth, making them stronger than they normally would if you don't use fluoride. There are a lot of popular toothpaste like a tumor toothpaste. There's this particular variant that does not have fluoride. Herbal toothpaste, charcoal toothpaste, and some other toothpaste don't have fluoride in them, and you need fluoride in the appropriate concentration. And the concentrations of fluoride in the toothpaste you use to brush your teeth are safe for your teeth as long as they are approved by the FDI and whatever body governs the consumption in your country. Refusal to use a fluoridated toothpaste is going to eventually weaken your teeth over the years and is going to lead to structural breakdown. We use our teeth every day to cut, to bite, to tear, and this takes a toll on the tooth. So the tooth needs a source of recharge, so to say, to get stronger. And if you deny your tooth or your teeth of this recharge, it is going to break down. It may not be immediate, but it's going to happen and you're going to have to lose that tooth. So prevention is better than cure. Before you purchase any toothpaste, look out for the active ingredient on that toothpaste. It's usually sodium fluoride, and then there will be a concentration written in brackets. Some toothpaste have 1,400, some have 1,450, some have 1,500. Any of these concentrations is okay for your teeth as an adult. Children can afford to use lesser, within the range of maybe 900 to 1,000 parts per million of fluoride. So be a smart consumer. Check these things, check your brushes, check your toothpaste, and ensure you're giving your teeth the right treatment that it deserves. So now that you have your medium textured toothbrush and your fluoridated toothpaste, it's time to brush your teeth. So you put your toothpaste on your brush using a very minimal amount of toothpaste. You don't need to load the entire brush with toothpaste, just this amount per brush is fine. You don't need to load your entire toothbrush full of toothpaste. This is wrong. This is too much. This is only wasting the toothpaste. A lot of people don't know the correct way to brush their teeth and they just put the brush in their mouth, switch it around for about 30 seconds, spit out, and they are done. No, you are supposed to have a systematic approach to brushing your teeth. As a rule of thumb, you are supposed to brush your teeth using gentle circular motions. So when you want to brush your lower anterior teeth, you hold your brush and you just go in gentle circular motions and you brush them up for your lower teeth. So gentle circular motions, brush up, gentle circular motions up. This ensures that bristles of your brush get in between the teeth and bring out whatever food particles that are stuck in between your teeth that can cause caries. And for the occlusal surface of your teeth, that's the part where you used to chew, you hold your brush and you go in gentle circular motions for about 30 seconds on each side. Same for the upper part. And for the front teeth, the upper teeth, you brush in gentle circular motions, downward stroke, gentle circular motions, downward stroke, until you've gotten all the parts of the teeth. For the inner surfaces of your teeth, you brush them outward and upward strokes. For the upper, downward and outward. That way you ensure that you get all the surfaces of your teeth. After brushing, you spit out your toothpaste, and some people argue in favor of not rinsing out your mouth, and some people say you have to rinse out the toothpaste in your mouth. Actually, this is a little controversial and you can choose to do any one depending on what you are comfortable with. But if you are prone to having dental caries, and let's say you've had a hole on your tooth before and you've had it filled, it's advisable to just spit out the excess toothpaste and avoid rinsing your mouth so that the excess fluoride can do their work and make your teeth stronger. It is also important to brush your tongue. Your tongue serves as the rug of your mouth. I call it the rug of the mouth because everything that comes in contact with your teeth touches your tongue. Still using your toothbrush with the toothpaste, just stroke your tongue gently, spit out the excess toothpaste. Some people would say you need a tongue scraper. I say you don't need a tongue scraper. Your brush does the job just fine. Some people go as far as brushing their lips to remove debris of food and at the corners of the lip. This is fine. You can just use your toothbrush to just quickly brush the corners of your lip, because when we talk, saliva and food particles can accumulate at the corners of your lip, and this can also cause odors. So you just want to take care of your oral health and do a quick brushing of your lip. That is absolutely fine. So we've talked about brushing, what you need to brush with, how you should brush, what you should brush, but I haven't mentioned when you should brush. It is important to brush at least twice a day. That should be the minimum. The first one is at night when you've eaten your last meal of the day and you know you're not going to eat anything else. And the second one is in the morning. Best after breakfast, because that way you remove the food particles in your mouth and you're going to prevent the action of bacteria on those food particles. But this is not really practical because a lot of people eat their first meal of the day, maybe sometimes in the afternoon, and they are at work and they can't easily brush their mouth. Brush before your breakfast, but if you can, it is best to brush after the first meal of the day, after the last meal of the day. So what is flossing? Flossing is the act of using a dental floss to remove food particles that are in between your teeth. There are different types of flosses and I'm going to show you the ones that I have. So this is one type. This is a dental floss and it comes in this string-like shape. And when you want to take it out, you unroll it and you use this stuff to cut the desired length you want. You can cut any length you want, it's totally fine as long as you can hold it between two hands, and you put this in between your teeth to bring out whatever food particles that are in between your teeth. It is totally safe and the best way to bring out food particles from your teeth. So this is another type of dental floss. It comes in this pack. This is readily sold in your local supermarket, even provision stores. So you just use this end of the floss in between your teeth and you use it to take out food particles. This is very handy. It's more convenient to use in public. This part of the dental floss is dangerous because it's sharp, and you can liken this to a toothpick. Try not to use this part of the dental floss, just use this part of the dental floss and that is perfect for your teeth. Avoid using toothpicks as much as you can after every meal because toothpicks are going to damage the parts of your gum that you're trying to pick the food from, and they hardly ever even bring out the food particles that are stuck in between your teeth. There are some recent advancements to flossing and people use this water floss these days. I'm going to attach a video here. They use this water floss that spurts out water and you can put it in between your teeth and it will remove whatever food particles are stuck in between your teeth. That is also very fine, but it's not inconspicuous to use in public. So the use of mouthwashes for your oral health is very good. However, it is advisable that you speak with your dentist before you start using any mouth rinse. Also, a mouth rinse should never ever replace brushing. They should only be used as an adjunctive treatment with brushing. So if you are somebody that you have plaque and calculus accumulation very often, your dentist may prescribe the use of a particular mouth rinse as an adjunct with brushing for a particular amount of time to your normal oral care routine to ensure that it reduces the frequency of accumulation of this plaque and calculus. There are some oral habits that we engage in that can destroy our teeth faster than it should, and this is based on different categories. So the first thing I'm going to talk about is what we eat. We use our mouth to eat, right? But what we eat can destroy the structure of our teeth if we don't take care of our teeth appropriately. And this is particular to the consumption of refined carbohydrates like biscuits, pastry, carbonated drinks and the likes, things that we commonly snack on. If you snack on these things very often, like every day, and you don't brush your teeth appropriately, you don't take care of your teeth as you should, you don't brush with a fluoridated toothpaste, or you don't brush before you go to bed at night, you are at more risk of developing dental caries because the bacteria have more substrates to work on and they produce acids that cause holes on your teeth. So if you're someone that consumes refined carbohydrates very often, you have to reduce it because it's actually not good for your health, or you increase how often you brush your teeth. So people also engage in habits like grinding their teeth together, and in dentistry we call this bruxism. So if you are someone that when you're under stress you find yourself clenching your teeth and you start grinding your teeth, some people do it when they're about to sleep, some people do it unknowingly. This continuous habit of grinding your teeth is going to lead to the wearing away of the surface of your tooth, and before you know it, the surface of your tooth is going to be smooth, and this is going to make you susceptible to sensitivity of the teeth. When you drink water, you are experiencing sharp pains and you have to wait a while for the pain to subdue. This is because the enamel, which is the outermost covering of your teeth, has been eroded by the continuous clenching and grinding that you do with your teeth. So this is very bad. If you clench or you grind your teeth very often, please stop. And if this is a habit that you've been trying to break, try to speak with your dentist. They can help you and they can fabricate some devices for you that will help you to break these habits. There are also other extra oral habits like biting your nails, sucking your thumb, and licking your lips and your tongue. These also have effect on your teeth. They can change the position of your teeth, making them more susceptible to fractures and eventual loss of your tooth structures. So if you also engage in other extra oral habits, try to speak with your dentist if this is an habit you are trying to break. People are masters of using their mouths to open bottles of Coke or carbonated drinks. Your teeth are strong, however, they have a limit. If you are someone that continuously uses their teeth to pop open a bottle of soda because they think it's cool, this can lead to the fracture of your teeth, and you may not even realize it until you start experiencing pains and aches. So avoid using your mouth to open bottles of carbonated drinks because this can fracture your tooth. Before you realize it, such tooth has to be extracted, making you lose your teeth and your beautiful smile. Last but not the least, it is very important to prioritize visiting your dentist at least twice a year. This is because they are able to check your teeth individually, assess the structure of your teeth, and they would tell you if you have dental caries or if you are susceptible to having dental caries. And these early treatments can actually save the structure of your teeth, as opposed to waiting at home till the pain has started and progressed, and then you have unbearable pain and they have to remove the tooth. So when you go to your dentist early, these are the things they pick up on and they help you to save your tooth structure. It is important to add that when you start feeling any sort of dental pain, self-medication and self-treatment should be discouraged. Go and visit your dentist immediately. The use of some substitutes like alligator pepper, alcohol, or gin. Some go as far as using carb battery water to apply on that tooth to relieve the pain. This is very bad, and you are worsening the prognosis of these dental caries. Immediately you feel any sort of dental pain, please visit your dentist as soon as possible and allow them to take care of your teeth and preserve your smile. I'll be ending the video today here, and thank you so much for watching this far. If you've not subscribed to this channel, please do, and let me know what other things you want me to talk about pertaining to your oral health. Don't forget to also like, share and subscribe, and I'll see you guys in my next video. Bye.